Well, healthcare reform was supposed to make healthcare more affordable and accessible to everyone, but right now what I am hearing is a lot of confusion and a lot of folks just scratching their heads going, where are we in all this? Well, Craig Gusson is here, our insurance expert here this morning, to kind of get us up to date. Let me give you a personal example, and I don't mind sharing this with folks. I just went and got my colonoscopy, and they charged me, I have an HMO with Cigna. They charged me $500 at the surgery center and called it a deductible on my, I don't get it. What happened?
I hear this a lot. It's actually a mistake. What you need to do is call where you had it done and explain to them under the healthcare reform law this should be free, and they will end up either waiving the deductible, or if you paid for it, they will reimburse you.
Yeah, I paid it. I mean, I had to split it between 2 credit cards in order to pay it. So.
Yeah, so that's what you end up doing.
Okay. So, folks, if you run into those types of situations where you just don't understand the fees and somebody's telling you that you owe them something, you need to really ask and make sure, because in this case, you know, I could have been out $500. I still am until we see what happens. But, well, explain what else is happening right now, what folks are dealing with.
A lot of things people are dealing with. I mean, Covered California just came out with the rates, and they gave rates for 25-year-olds and 45-year-olds, and they did a great job on what they were trying to accomplish. Unfortunately, what happened is exactly what you and I have talked about for the last 3.5 years, and that is that rates have to go up. So when
they were supposed to go down under health care reform, and the opposition to this health care reform kept shouting this from the mountaintop. They're going to go up, and yet people still said, "Oh no, it sounds great."
It does.
I mean, one side had to be right, and the other side had to be wrong. It turns out in this case, the folks that said it was going to go up were right.
So the problem you have is now it's guaranteed issue, which means anybody can buy it, regardless of health history. So the insurance companies, all they do is finance America's health care. So they're going to do that. And to give you an example.
So it had to go up because people that have pre-existing conditions that might be very costly to treat are now entitled to the same health care insurance as everybody else without being rated for that previous risk.
Correct.
Ratepayers have to cover the cost. So everybody's rates go up.
Exactly. If you get a car loan based on your FICO score, depending on what kind of deal you're going to get, but on health insurance, everybody's going to have the same thing. So what happens is, I just wrote a 26-year-old girl a $4,500 deductible plan. It was $84 a month. The same plan under the healthcare reform law, called the bronze plan, it's a catastrophic plan actually, is like $130 a month. And that's a $6,400 deductible versus a $4,500.
So bigger deductible and more expensive.
And more expensive. And you're going to see this. You're going to see for all the different ages, and they haven't announced each exact age bracket, you know, age 0 to age 65, but those rates are going to go up.
Yeah, I see one here. A 40-year-old with a silver PPO plan will pay $308 or more per month, depending on the insurance company, whereas the same person today could pay for a similar plan for as little as $205 per month with a lower deductible and lower out-of-pocket for major medical expenses. And you're just seeing that across the board. That's the 40-year-old.
That's a 40-year-old. So June 6th, they're going to announce group rates. And once we get all that, then what most people want to do is they're going to want to contact your agent and start talking about options. Blue Shield announced at a meeting I was at last week that they're going to be sending letters to everybody who owns an individual Blue Shield plan, telling them that their plan is changing January 1. The bad news of all this is everybody in San Diego County is probably going to have a rate increase January 1, regardless if it's group or individual. And that's a big deal, because for group insurance, I've always told my clients, you know, your rates are guaranteed for a year, but under the health care reform law, the insurance companies have to start paying for the taxes and fees January 1, which means they're going to end up sending those expenses down to the consumers. So rates will go up for everybody January 1. Individual plans, they're gone. Everything's totally different January 1. If you have an individual plan today, it's not going to be the same January 1. The insurance company is going to migrate you into one of the plans that's allowed by Covered California or by the government. And you're going to have to work with your agent and figure out which plan works best. Depending on how much money you may get some subsidies. So if you're making, you know, anywhere from $1,000 a month to $4,000 a month, you're going to get some subsidies from the state for an individual.
All right. Craig Gusson, again, you're going to just have to come back on a regular basis and just keep us updated on all this.
My pleasure.
Right now, it's work with your agent, ask a lot of questions, and don't take anything for granted.
Exactly.
All right, Craig.